Good evening, Dr. Nyla
Good,
Goldenberg. How are you?
doing well. Good evening, Dr. Grisha. We have a cat here.
The cat came to say hello. Okay, hello.
Yeah.
Hello. So I'm Katina Grisha. I'm functional medicine and internal medicine physician, and my guest here, Dr. Nyla Goldenberg, functional medicine endocrinologist. And
Yes.
it's our pleasure today to talk about the celiac disease, since it is Celiac Disease Awareness Month. And we
Yes.
thought that there are so many people out there that have symptoms that they don't know what to do with, and they have not been given an answer. And we want to shed some light into what you're experiencing and what can be done about it, and how it is done actually from a functional medicine approach point of view. And then you can discuss with your functional medicine practitioner and improve your health and your life. Absolutely. So just wanted to clarify that this video is for educational purpose only. It does not establish any patient-doctor relationship between any of us and you guys out there that are listening or watching. And so let's jump right into it.
That's good.
So all of us have patients with celiac disease, and everybody started with some non-specific symptoms, and everybody was sent to the gastroenterologist at some point, right? Make sure there are no structural issues. But if they had GI symptoms, right? But there are so many people that those are not the major manifestation, but totally, like symptoms that can be due to a lot of other things. And people start Googling and they get more, confused about Dr. Google's opinions instead of, going to a functional medicine practitioner again. So what has your experience been in terms of patients that come and you discover celiac disease?
Oh, there are several scenarios for endocrinologists how we can discover the celiac disease. And one of them, not very rare, actually, one, when patients come to us with very high doses of levothyroxine, which is replacement for hypothyroidism, or some people may be on high dose of Armour thyroid or other versions of NP thyroid and such. And their TSH is still very high and inappropriately high. One of the thinking right away that they're not absorbing their medication. So that's where one of my triggers to check for celiac will be that. But other things I remember a patient, man, he and his wife were trying to get pregnant and couldn't get pregnant. So he was sent to us because of possible of male infertility. So it's, in fact, I was actually listening recently to statistics about infertility. Men and women, they're about same responsible for infertility. And so apparently celiac disease is one of the causes of male infertility. And as soon as that man, we discovered that, we found his liver tests were high. He didn't have that many of gastrointestinal symptoms. That's where we usually think about celiac. But as soon as he became gluten-free, they were able to get pregnant within literally like 3 to 4 months. So that was miraculous change. What about your patients?
Amazing. So far, I've seen mostly people with gastrointestinal issues and some with actually arthritis, with inflammatory, changes in their joints. And when, nothing else, when all fails, right, you look at the gut. And in functional medicine, we do this test called GI map, which looks at all the bacteria, all the microorganisms in the gut, which are trillions, right? And it's by DNA, so it's not like it grows or it doesn't grow. It's either there or it's not there, period. But you also look at the anti-gliadin antibodies, which can occur in celiac, but so straight gluten, anti-gluten, but also against certain foods that are gluten-like, right? Like cross-reactive. So looking at millet and corn and rice and so many other things, oats. And that's where I discovered the celiac, the gluten sensitivity.
Intolerance.
Absolutely.
Yeah.
And once you eliminate that, people feel so much better, so much
True.
better. Yeah. But fertility, I think it's huge because so many couples have problems conceiving these days. And most people, what do? They go to a fertility specialist, right? And there they look strictly at hormonal issues, not so much like really like conceiving issues, really not at the whole scenario. And definitely this can be such an easy fix, and it doesn't cost tens of thousands of dollars and suffering.
Correct. Yes.
Absolutely. Yeah. So what other, interesting interesting symptoms have you seen with people with celiac?
I've seen a rash. I had another person who actually worked with me back years ago, and her main symptom was a rash that would appear on her arms and legs, and it would itch a little bit. And I think it was dermatologist who made the diagnosis of celiac disease, and it's called herpetiformis dermatitis. It looks like herpes, but it's not. Looks like shingles, but it wasn't shingles. It's was like a small vesicles appearing on a skin and a little bit itchy, and it would come and go. And of course, it would be more pronounced after eating some high gluten foods. And to verify the usual reasons for or usual examples of gluten containing foods will be rye and wheat, but we do have other ones, including the oats, but oats by themselves, they're gluten-free. But since they usually grow right after wheat, they will be contaminated usually. Yes, unless you grow oats specifically from gluten-free oat seeds and grow it on gluten-free places, not surrounded by any wheat whatsoever, so there will be no contamination, because true celiac disease, they are very, very sensitive to gluten, and even small contamination in so many particles per part of the whatever food, it's going to be producing issues. So people with true celiac disease cannot have anything cross-contaminated. So they are not an option for them to have prepared food on the same skillet. They have to have completely washed out skillet and washed out utensils. And so it's definitely presents a problem when you go to eat out and contamination is all over. More than that, for truly celiac disease, it's not only in the food, but you have to watch and check your toothpaste, check your shampoo, check everything that you are utilizing, and everything has to say gluten-free and preferably gluten-free certified. And there are people who are not celiac, but have a lot of very similar complaints, and they have different version of immunological response. They will present with high IgG4 antibodies for gluten, but it's not transglutaminase antibodies that we usually see with celiac disease in the blood. And those people are non-celiac gluten intolerance. However, their changes in the guts will be exactly the same. And because of that, they may present with exactly similar gastrointestinal symptoms, and therefore treatment is exactly the same.
Yeah, like recently I have a child actually that has had some, intestinal issues, And she was tested. They did the tissue transglutaminase antibody, so it's a blood test, which was negative. But when we did the GI map, the stool test, she had very high, almost 3 times the upper limit of anti-gliadin antibodies. So definitely it cannot, the diagnosis cannot be made just from a blood test.
Correct.
Definitely. It cannot be
Absolutely.
ruled out. Definitely.
Yeah.
Super. So besides gluten, elimination of gluten and everything, because I think a lot of people have no idea that they have to use everything gluten-free. What else do you see in terms of treatment possibilities and in terms of response to treatment? What do you see besides, of course, the happy fertility resolved issue couple?
Yeah. The gluten-free diet is the main stream, and honestly, once in a while I see people have to use steroids to reduce the inflammation, but that's for certain cases, just specific cases. But in reality, it's not long-term treatment. The only treatment is gluten-free diet, unfortunately, for people, because it's hard. People don't like staying on gluten-free diet, especially if gastrointestinal symptoms are not the main concerns for them. But the long-term problems are concerning because they are more susceptible for different colon cancer and gastrointestinal cancers. They are more susceptible for bone density reduction, so osteoporosis, thin bones and fractures related to that, different vitamin deficiencies and mineral deficiencies because their guts are not capable of absorbing many of the nutrients. Iron deficiency becomes one of those, and so on and so forth. Yep.
Right. So everybody needs to do definitely the vitamin and minerals blood levels, and
Absolutely.
preferably micronutrient testing to make sure that they're replenishing all of that properly, and to be on, vitamins for life, because they, of course, when their gut gets, there's no inflammation, it's wonderful. And if, but those, the villi will still be affected. So definitely have to provide extra sources of vitamins and minerals. So
yeah, absolutely. Yeah.
Super. So we hope that we gave you some information that is valuable, and that you will definitely, some of you who have these symptoms, consider checking with a functional medicine practitioner. And Dr. Goldenberg is in Cincinnati. I'm in Chicago. And for everyone else, everywhere else, please find the functional practitioner close to you and put an end to suffering, because everything can be fixed.
Yes.
Thank you so much. Have a good night.
Good night.
See you soon.